All right, so we're sitting here, Dr. Ross Greene, prolific. I'm gonna pass it along to you and kind of let you tell our listeners who you are a little bit.
Well, I'm Ross Greene. I'm a clinical psychologist, best known probably for my book, The Explosive Child and Lost at School, but also Lost and Found in Raising Human Beings, and known more recently for the documentary film produced by my nonprofit, Lives in the Balance, called The Kids We Lose. I guess that's who I am, father of two, live in Portland, Maine. And so far, so good in surviving the pandemic.
Yeah, right.
That's good.
Yes.
This pandemic has been slowly murdering my soul. If I'm going to be totally real with you, this thing has been unbelievable. Surprisingly, I thought I had an eating problem before, but this has been definitely exacerbating my
Highlighting,
reality.
yeah.
Oh my God, I got to
This,
really work
this has
on
been
that.
perfect for me. I've lost 17 pounds during the pandemic, mostly because I'm not speaking in places that serve chocolate chip cookies. So it has been quite the boon for me.
Oh wow! All right. Well, I have to take a cue from your list.
Yeah.
Thank you for joining us, Dr. Greene. I have to tell you that we've been doing the podcast for a couple years now, and mostly we highlight behavior analysts and we talk about specifically in-field, kind of inside baseball stuff. But after watching the kids we lose and then watching you talk, I feel that there is so much that you have to say that is much more behavior analytic than a lot of the way that people who do behavior analysis conventionally actually even operate in their fields, and where there's a lot of dogmatism that drives the field. So I was kind of hoping that you would. I wanted to kind of start a little bit for how you got to where you are and kind of what makes you the practitioner that you are. So why don't you start a little bit? How did you even get to psychology?
Well, it was either going to be animals or children. And I'm not a big fan of blood, so that made it children. And then it was going to be either teaching or psychology. And then it was finding myself attracted to kids who are struggling, and the challenge of understanding them and the challenge of helping them. So then it became psychology. And then it became clinical psychology. And I was trained in a behavioral program. I wouldn't call myself trained in behavior analysis per se, but it was a behaviorally oriented program. More accurately, a cognitive behavioral program. But of course, that can be meaningless as a descriptor,
Yeah.
because it really doesn't tell you that much about where somebody's coming from. And I would say that where most of the professors that I had in the clinical program were coming from was behaviorism. And as it relates to dealing with behaviorally challenging kids, more of the operant school of thought, flowing from Jerry Patterson and the folks who came after him, and parent management training. So then it was I found myself especially gravitating toward kids with ADHD because I found them to be fascinating. Even though I would not say that had been ADHD myself, for some reason they fascinated me. And then, of course, if you're working with kids with ADHD, you're going to be working with kids with oppositional defiant disorder, and that's who began fascinating me, and conduct disorders. And that's sort of where I've stuck, mostly because I have found them to be among the most misunderstood. And then, some of the research that I and others have done, for a while, people thought, and I'm not a very diagnostic person, but for a while, people thought of oppositional defiant disorder as sort of a fake disorder. But it really has tremendous implications for a kid's outcome. And so these are not insignificant behaviors that comprise what we call oppositional defiant disorder. And in fact, I see non-compliance as, quite frankly, the gateway behavior, right? If there's a gateway behavior, non-compliance is it, because it takes you down a completely different path. If you're crying, or if you're unhappy, and not to minimize those, by the way, or if you're anxious, not minimizing any presentation, I find that adults have a tendency to be more empathic. But if you are non-compliant, And if you are expressing the fact that you're having difficulty meeting certain expectations with behaviors that might fall into the more aggressive realm, screaming, swearing, hitting, spitting, kicking, biting, throwing, destroying, you actually set yourself up, not that you're doing this on purpose, but you are primed to get the worst adults can throw at you. And a lot of that is depicted in the kids we lose. And, to me, that's a fascinating kid. That's a very misunderstood kid. If the primary thing that is separating one kid from another in terms of outcome and in terms of how adults are going to deal with that kid and view that kid is non-compliance, well, then there's something to this non-compliance business, and especially something to how we adults interpret it and deal with it. Because it's not just the kid here, it's how we deal with it that has a huge impact on this kid's outcome. And so I've been fascinated by these kids for going on 40 years now, and they continue to fascinate me. It's just a fascinating field, and hopefully I've contributed something to it.
I have to say that was the thing that attracted me to what you had to say, because I've been kind of on a mission to find people that aren't in field that are doing good work. Mostly because and I'm going to speak for myself, the degree of dissatisfaction that I've had in encountering fellow behavior analysts in the way that they conceptualize problems, the way that they see contextual variables, environmental variables, just random confounds, and how those things can influence a person's responding, and how important those are in painting a full picture rather than being stuck in a strict operant paradigm where they're just straight SD behavior response kind of mindset. Is kind of what's made this is going to make this, I think, a very robust discussion. So, in relating to non-compliance specifically, when we're talking about that, I think the point that you're bringing up that I would like to explore a little further is how we characterize these particular types of behaviors in terms of the implications the words we use to describe them are, and also, in general, the role of diagnostic labels and sometimes how they can operate as a crutch for us, because or they operate as limiting in imagining what you can do, because that's my perception of it. My perception is that they can be informative and that they can give you a general idea of kind of what might be going on, just broad strokes, but they don't really tell you anything about the individual circumstances, the particular case, and how to necessarily approach that human being that's sitting across from you. What are your thoughts on that?
Oh, boy, got a minute?
I got 2 hours, my man.
Diagnoses are very limiting, but here's why. The search for homogeneity is not necessarily a tragic thing as we try to understand things better. So, in some ways, the diagnosis of ADHD has in some ways moved the ball forward, but ultimately it's limiting. Oppositional defiant disorder, in some ways, has moved the ball forward. Researchers, first of all, if you want to get a paper published, it probably needs to be on a diagnosis if you want to get into one of the better journals, or they're not going to accept the paper, right? So I'm limited in terms of what I can publish. If I'm studying a treatment, it's got to be a treatment for something, right? And so my treatment technically is for oppositional defiant disorder, but I find that extremely limiting because I find that my approach isn't just effective with externalizers. It's also effective with internalizers. It's not just effective with exploders. It's also effective with imploders. So the limiting part to me is unquestionable, right? But here's the more important part. Diagnoses are comprised of behaviors. Non-compliance is a behavior. Technically, it's non-compliance with an adult directive. Why would an adult be giving a kid a directive in the first place? Because the kid is not meeting a particular expectation. So these days, I refer to behaviors as late. Behaviors downstream. What's upstream? The expectations the kid is having difficulty meeting. What's early? The expectations the kid is having difficulty meeting. And so the entire collaborative and proactive solutions model has been built around the science of expectations, not the science of behavior. Now, there's a lot of science on behavior and what will modify it. It's just that, in my view, if all we're focused on is behavior, which I view, a lot of people a lot of critics of the behavioral approach refer to behavior as the symptom. That's not my preferred term. I prefer signal. I prefer fever. I prefer the means by which the kid is communicating something very important. I'm stuck. There are expectations I'm having difficulty meeting. For me, that's all behavior is, whether it's whining, pouting, sulking, withdrawing, crying. I refer to those as lucky behaviors. Or screaming, swearing, hitting, spitting. I refer to those as unlucky behaviors, right? All diagnoses do are capture behaviors, but behaviors are just a signal, just the means by which the kid is communicating that there are expectations the kid is having difficulty meeting. And, having worked with kids in prisons and inpatient psychiatry units and residential facilities, kids who've had lots of quote unquote treatment and a lot of it behavior modification. I think that the limits of focusing only on behavior are crystal clear. We're missing the big picture if we're missing the expectations the kid is having difficulty meeting that are causing the behavior. So really, no matter how we configure it, you're either focused on the behaviors, which once again are late and are just the signal, or you're focused on the expectations the kid is having difficulty meeting that are causing the signal, what in my model we call unsolved problems. And that huge difference between those two heads us in very different directions. I think if we're focused on behavior, to tell you the truth, if all I was focused on was behavior, I wouldn't be able to think of anything else to do except to modify it. But if we just treat behavior as the signal, then it permits us to look deeper. What's really going on with this kid? Better yet, what does the kid have to say about that? So we're no longer being unilateral. The pressure's off for us adults to figure it all out ourselves and to feel that we are on the hook for carefully understanding environmental contingencies, arranging contingencies on our own without any input from the kid so as to mold this kid in the direction that we want the kid to go. We've got a potential teammate. We've got a potential partner, the kid. And boy, in that little bit, I've just said a lot about the difference between collaborative and proactive solutions and a lot of other ways of doing things.
I think here's what I love about what you just said. Number one, if I were put my hardcore behaviorist, my Skinnerian hat on, I think we'd have quite a few bones of contention between the two of us. But that would be conceptual nitpicking, because I think when I hear you say the distinction between meeting expectations and behavior, I'm hearing the distinction between problem behavior as it occurs as a form of communication and various motivating operations and or environmental variables that are putting the person in the position where that behavior is occasioned, and being able to target those particular stimuli that are exerting that kind of control on them. Now, that's a long-winded way of saying something that you said, which in my opinion is better because it's more accessible. I think that's a problem that we encounter on our end of the side in terms of when we're talking about behavior analysis. That it's so jargon laden, that the inaccessibility of language and the lack of meshing well in the way someone will conceptualize a problem behavioral or like a specific behavioral problem limits our ability to be effective. And then also it puts us in a situation, which you kind of hinted at, to just be behavior modifiers. So we're non-functionally targeting behavior to change almost like it is Clockwork Orange and we're just trying to control them, rather than creating solutions that are designed to affect a holistic picture of what a person is and what a person's situation is, and then in lieu of doing that, bringing them into the process rather than just making them, I don't want to say the target, but uh, just the thing that we happen to be exerting or attempting to exert control or behavior change on, which almost kind of depersonalizes and dehumanizes the situation. So I think everything that you just said was on point and can be translated very effectively in the way that we would go about do it. I did have a question. I had a question I wanted to ask you. Are you familiar, or maybe you're not, with Greg Hanley by any chance, or any of his work? Have you heard of him?
It's a familiar name, but I wouldn't be able to put my finger on it now.
I have to say, when I heard you, I was like, "This is the psychologist version of him." He like his work is focused on the notion of synthesized contingencies and complexity, and not reducing behavior down to singular responses, but looking at all function is socially mediated. It's tangible. It's complex. Any analysis that you do should account for just the inability to necessarily reduce that from a whole and treat it as a whole in and of itself, and focus on exactly the things that you're talking about. Focus on intervening in a way that you bring the learner in, focusing on meeting their needs rather than imposing your will on them. All that stuff is just I really see like there's a beautiful marriage to be happened. There's so much robust research I feel like that could happen because I feel,
No
but
question.
that's
Have to
very
look into it.
fascinating. You have to look into
Here's the
synthesized
interesting thing.
contingency analysis. Fantastic work.
I'm not positive. I'm not. There's a good example of language that has the potential to lose people, right? And I pride myself on language that is accessible and on explaining things in ways that are accessible. Now, I'll look into his work because it sounds like we are simpatico. But the interesting thing is, I have had some interesting conversations with behavior analysts, and we actually kind of came to the conclusion that except for vastly different terminology, we weren't necessarily saying things that were completely different, at least in some respects. Mm-hmm. For me, just to be oversimplistic here, are you focused on the overt manifestation of the kid letting you know that there's an expectation the kid is having difficulty meeting? Or are you focused on the expectation the kid is having difficulty meeting?
I love that.
A lot of the terminology could actually mesh. I mean, one of the things one behavior analyst who had developed his own model said to me was, boy, you say things in ways that are so clear. Well, that's because I don't feel bound to stick with a certain language. I'd rather stick with the language that is going to make sense to people, not just to behavior analysts. I mean, let's face it.
It's a very pragmatic
behavior analysis
approach.
has its own language, right? Unfortunately, a lot of people don't understand that language who are outside of behavior analysis, right? That's a problem for behavior analysis, right? So, but that aside, I don't think our terminology is very different. I'm not sure that we are referring to completely different things.
Yeah.
Once again, what I really come back to is, what are we primarily focused on? Modifying behavior, for which there is quite the terminology, or solving the problems that are causing those behaviors, for which I've developed a bit of terminology. That's why I don't actually consider myself especially well-versed anymore in behavior analytic terminology. I'm immersed in my own terminology, but there's an interesting paper there, if I ever had time to write it, about how in many respects, while the terminology is different, we are referring to similar things. That's okay, right? Whatever, right?
Yeah.
Yeah, that's just words.
Agreed.
That's
I was
just words,
speaking
man.
Russian, then we would have different words for the same thing too, right?
Exactly.
That doesn't matter so much. You can always get a translator. What matters is, what does the model point us to focus on? Overt behavior or the problems that are causing that behavior. And if you are in problem-solving mode, are you being unilateral in that problem-solving, or are you being collaborative in that problem-solving? Is the kid your partner, or are you imposing your will because you've got it all figured out, right? To me, that's where I don't want to get too caught up on language, because once again, if we're referring to similar things, big deal, if we're saying it differently. But if we're being pointed in completely different directions, that's a big deal.
Do you think that just in general, just because of the way attitudes have shifted over the past 30 years, that people are more open to what you have to say, and just our perception of children in general? Because one of the things that came to mind that I hadn't really thought of before, and listening to you say it rather than reading it in a techno jargon speak, was that, like, man, this is, when I think about my own childhood experience, I was raised by a pretty old-fashioned, old-school disciplinarian type, and that is just the opposite of what a collaborative, proactive solution would look like in terms of bringing someone in. But really, it is designed and creating more well-adjusted people, in my opinion, in reality and in fact. So what do you think is that what's attributed to some of the acceptance that you've been able to see and what you've been trying to do?
I'm not sure. I don't know how successful I would have been talking about this 30 to 40 years ago. I know that Thomas Gordon of parent effectiveness training and teacher effectiveness training fame, who's now no longer with us, I'm pretty sure. I don't remember who's alive and who's not alive anymore, but I'm pretty sure that Thomas Gordon has passed. But he was saying things that were not that dissimilar 30, 40 years ago. So I don't know what accounts for the receptivity. I will tell you that I certainly still run across a lot of people who are not especially receptive.
Yeah.
Because of old ways of thinking. So I don't think we're there yet by any stretch of the imagination, but I would have been curious to see what would have happened had I been talking about this stuff 30 to 40 years ago. To tell you the truth, I think here's the major advantage I have that Thomas Gordon did not have. I got 40 to 50 years of research in neuropsychology telling me about the skills behaviorally challenging kids are lacking. That research has only been there for the last 30 to 40 to 50 years. So it came after B.F. Skinner.
Yep.
It came after Thomas Gordon. One of my mentors occasionally, when we talk on the phone, will say to me, because he's still quite the behaviorist, he'll say, Ross, how did behaviorism miss lagging skills? How did we miss it?
Yeah.
Right? Well, first of all, maybe I'll say to him, maybe behaviorism was a little too content that it had it all figured out. But also, all that research came after B.F. Skinner figured it out. That's meaningful. So that's my advantage, right, over forerunners like Thomas Gordon. He didn't have that research to hang his hat on. I'm very safe in saying that behaviorally challenging kids are lacking crucial skills. I'm very safe in saying that challenging behavior primarily occurs when a kid is having difficulty meeting a certain expectation. I'm on safe ground, right? Some people missed it, but it's right there, low-hanging fruit.
I agree. No, it's so, some of the most profound ideas are just the obvious ones, right? I mean, they don't have to, it doesn't have to be linear algebra for it to be profound, and sometimes the things that are staring you in the face are things you walk right by. I think one thing to what you just said is that the Skinner thing, because I think it's Skinner's, I mean, we talk about Skinner a lot on our podcast, and it's funny because I will say that Skinner had one thing in his writing that he did that I always find interesting, and that is a cop-out. His cop-out was that if he didn't know the answer to a thing, he would say the technologist or physiologist of the future will handle it. Like, that was he had that little always just And you know, you just quoted basically the physiologists of the future when you're talking about neuropsychology and neuroscience, have giving you empirical explanatory framework and valid data points to springboard off of, like being able to form an adequate
And
conception of
here's
what
the
you're looking at.
deal. Here's the deal. That's okay,
Yeah,
right? That's fabulous, right? I don't know if B.F. Skinner thought he had it down pat,
right.
right? I'm hoping that a really smart guy like B.F. Skinner knew that science would eventually modify what he put out there. How could it not be otherwise, right?
Yeah.
I've put out collaborative and proactive solutions. How could it? Truth is, collaborative and proactive solutions is continuously being modified, right? We are continuously tinkering with it in response to science and in response to people's responses to collaborative and proactive solutions. That's the way science works, right? So science is not, here's the way it is, love it or leave it,
Yeah.
right? Science is, here's where we're at right now, pending future science modifying these ideas. So this is the interesting thing. That's why I'm not anti anything, right? Well, I'm anti restraint and seclusion. I'm anti suspension, detention, expulsion, paddling, but I'm not anti applied behavior analysis. First of all, there are many BCBAs who love collaborative and proactive solutions, right? Love it. Think it fits right in, except for the different terminology. They think we're saying the exact same thing. I'm not so sure, but they think we're saying the exact same thing. Good. So those are people who are saying, yeah, I get it. Here's what radical behaviorism would say about what I should do. And here's what the science that has accumulated over the last 34 years should tell me to do. And I cannot ignore science. So I'm going to incorporate the science of the last 30 to 40 years into what I do.
I mean,
That's
you're
great.
it's I mean, but here's the thing with what you just said though, and that I think is very critical. And I think, you know, and this is our constant critique, and we moan about this is like our, you know, our reputation at this point for the horses that we beat to death, is that it's, you can't think, human beings are not just, you can't just modify individual behavior and think that you're actually making an impact or a change on the world. And you also can't think that that's actually going to produce a viable outcome that's going to change things meaningfully. Meaningful solutions require going to the root of problems. And if you want to be something called an analyst, you have to be able to take a problem, identify it, break it down, understand it, deconstruct it in such a way to be able to go to the root and hit it there, and intervene there, rather than think of just, if I manipulate these particular consequences, like you call it, carrots and sticks, you know, which is basically what it is when it's all said and done. Oh, you're not really achieving anything that matters, because you're not addressing the person specifically where they are and meeting them where their needs are. And in my opinion, when you're talking about meeting needs, that's just about really hitting the dynamic aspects that make behavior happen, and being a lot more thoughtful about and creative in terms of intervening where you need to intervene. So I don't know. That's my
Yeah.
perspective. Is I think that what you're saying is totally on point. I think the language that you use, if someone wanted to be a ridiculous person, would argue about agency and that kind of stuff. But when we're having those conversations, we're just talking about philosophy at that point. We're not talking about practical, pragmatic solutions to what's going on. So those become irrelevant points, in my opinion.
Part of that kind of piggybacks off of one of the questions that I had, which was you've talked about unilateral, referenced it a couple different times. Um, was there an unpopular behavior analyst, I would say Israel Golddiamond, talked about nonlinear contingency analysis, and the idea was there's multiple different streams that are influencing somebody at any given point in time. Was there a time in which you kind of I don't know, like a story or a time where you realize like, oh, it isn't this mechanistic, approach one at a time. Like there's
Oh,
there's
yeah.
multiple sources here going on.
Well, in a very basic way, I was working at an ADHD clinic as part of my internship at Children's Hospital in Washington, D.C. And this was when some of the luminaries of ADHD were at Children's Hospital.
Mm-hmm.
Wade Horn was there, Keith Connors was there, some others. but I was working in an ADHD clinic. And back then I was viewing everything through the prism of this kid's challenging behavior is because of inept, passive, permissive, inconsistent, non-contingent parenting. And what I need to do is adjust the contingencies, and this kid will be better. And this is an interesting thing. And there was one kid who I was working with who was not a responder to that approach. And then he went on stimulant medication. And he was a completely different kid. And that was the light going on for me. I said, wait a minute. These parents were incompetent disciplinarians pre-Ritalin, and now they are competent disciplinarians post-Ritalin, and they're not even the ones who are taking the Ritalin, their kid is. So what that told me was, we changed something about the kid here, and all of a sudden, he's well behaved. And all of my assumptions about what these parents were doing wrong just flew out the window, right? Because of a pill? Seriously? And the whole treatment plan changed because they didn't need what I was offering anymore because their kid was now medicated and was not the same kid anymore, right? So there's lots of experiences that I've had where it turned out that's not what it is, right? This is not passive, permissive, inconsistent, non-contingent, inept, neglectful parenting. These parents have other children in their home who are well behaved. That's when I started looking into more research on the lagging skills that go along with ADHD. And that is also when I started questioning whether ADHD, which is comprised of a bunch of behaviors, really tells us what we really need to know about this kid. Or do you know a lot more about this kid and what this kid is struggling with? Not through the kid's behavior, but through the skills the kid is lacking. And boy, the whole universe opened up. And I got to say that one of the most influential people there was somebody who I worked with for a time, Russell Barkley, who wrote quite a bit about Bronowski's theory and how it overlapped with executive skills. And boy, those were some dense articles. But if you read them 8 to 10 times, then they start to make sense to you if that's not sort of the language that you speak. But the world that opened up for me, not just because of Russ, but because of other people who are writing similar things, was what an advantage there was to viewing this kid through the prism of lagging skills and the expectations this kid was having difficulty meeting, rather than focusing solely on the overt manifestation of those lagging skills and unsolved problems, the kid's behavior. And that's when things started to shift. But it was that kid and a little old medicine named Ritalin that sort of propelled me into looking into this further, because the difference was so dramatic. How does he go from being ill-behaved and all of these things, all of this language we've built around these kids and the language we've built around their parents and what they're doing wrong, how does all of that change just because he's now on a stimulant medication? There's got to be something more to it than that.
What is your overall take on meds?
I love them when they work on the things that they should be prescribed for.
Yeah, because they can definitely be they're a dice roll sometimes, especially with our guys.
Stimulant medications have a pretty good track record.
Yeah.
Beyond that, it gets a little bit dicier. Side effect profiles are very variable. I find that in North America in particular, more of the United States than Canada, we over-medicate because it's easy. I think that once we figure out what a kid's lagging skills and unsolved problems are, here's the interesting thing. You call a kid ADHD, what occurs to you to do next, right? Now, Bill Pelham would say what should occur to you to do next is a contingency management program. But what happens in the practical world is the prescription pad comes out.
Yeah.
You figure out what skills a kid is lacking. First of all, you have a much better understanding of what's going on with that kid. Secondly, the kid becomes a whole lot more predictable, right? ADHD doesn't help me predict. Knowing that this kid has difficulty shifting from one mindset or task to another, that helps me predict. So in terms of what helps me know what's going to happen next and when it's going to happen, I'll take lagging skills and unsolved problems over behavior or diagnosis any day of the week. But the medications that work, if a kid needs it, I don't want to deprive the kid of it. I just think we overuse them. If you figure out what a kid's lagging skills are, I don't know if you think medication first. If you think ADHD, I think that a lot of people do think medication first.
Yeah, that's definitely that's my experience as well. So actually, this is a great segue into a question I had for you in terms of something that you're characterizing where, you talk about skill deficits, and I'm in 100% agreement in that because, I mean, what you're talking about behaviors to me and behavior modification is teaching someone to a dead man, which should be against the rules for what we do. Our job should be increasing behavior, which means we should be teaching skills, which means we should be teaching skills people need to function in their lives. But you made a distinction somewhere, I can't remember where I heard you say it, between replacement behaviors and skills, particularly, or skill deficits. Could you give me a little bit more about like the distinction that you draw there?
Yes.
Okay.
And this is very important, actually.
Okay.
The skills I tend to focus on are generically the skills of flexibility, adaptability, frustration tolerance, problem solving. And on the instrument that I developed called the Assessment of Lagging Skills and Unsolved Problems, I've listed 23 lagging skills that roughly fall into those realms. So there are some executive skills in there. There are some language processing and communication skills on there. There are some self-regulation skills on there. There are some cognitive flexibility skills on there. And there are some social skills on there. The main reason I list lagging skills is because I want to change people's lenses, because people are accustomed to thinking about motivation when it comes to challenging behavior, or why a kid isn't meeting certain expectations, or why a kid is exploding. And what I'm thinking about when I'm thinking about why a kid is exhibiting those unlucky behaviors are skills that are related to flexibility, adaptability, frustration tolerance, and problem solving. I think those skills, or the lack of them, explain why some kids respond to expectations they're having difficulty meeting in ways that are relatively adaptive versus ways that are relatively maladaptive. I think that if you have the skills to respond to expectations you're having difficulty meeting in ways that are adaptive, you do. If you don't have those skills, you don't. So those are what I'm referring to when I'm talking about lagging skills. There are people who refer to skills as behaviors. So they would say, difficulty sitting next to Timmy during circle time. Sitting next to Timmy during circle time is a skill, they would say. I would say that's a behavior, right? And then what they will do is they will say, all right, we need to teach that skill and we need to reteach that skill so that Timmy has a replacement behavior when it comes to sitting next to the kid during circle time. To me, that's largely teaching and reteaching behavior, what I would call a replacement behavior, right? So if the maladaptive behavior is standing up during circle time or bumping up against people during circle time, right? Those are behaviors, right? If we are simply teaching Timmy what to do instead, or reteaching Timmy what to do instead, then we are teaching and reteaching replacement behaviors, but are we making a dent in the skills that Timmy is lacking? No. Have we engaged, by the way, skills that explain what's making it hard for Timmy to sit still during circle time, right? Maybe even more importantly, have we engaged Timmy? I don't remember who was Timmy and who was not, but let's say the kid was having difficulty sitting with Timmy. It might have been that the kid was having difficulty sitting next to Timmy. Timmy, for our purposes, is the kid who's having difficulty sitting still in circle time, right? Have we engaged Timmy? Have we asked Timmy, what's hard about sitting next to so-and-so during circle time? Help us what's difficult for you about that? I don't know what Timmy's going to say, right? I'm dying to find out what Timmy's going to say. If all I'm doing is teaching replacement behaviors, I'll never know what's really getting in Timmy's way. I will never be able to collaborate with Timmy on what's getting in his way. All I've done is say, here's what he's doing that we don't like, that's behavior. Here's what we want him to do instead, that's the replacement behavior. I will now embark on knowing nothing about what's really getting in Timmy's way, but teaching him what I want to do instead. And not only that, making it worth his while.
Dynamic categorization. That's I'm telling you right now, you need to look up Greg Hanley. You guys you are cousins.
Cousins would be a good way to put it.
And like the way you speak and everything.
I cannot believe
engagement.
It. I mean, he has a treatment package that I did my thesis on it, and like it's an area that I'm fascinated by. And it's when I read about the CPS and I looked at it, I mean, CPS is basically the ADHD kind of more sophisticated type learner version of what his got going on, because his is a lot more tailored to more high intensity, intellectually impacted folks. It is translatable, but it kind of struggles when it gets to that point. And in your components, I think, where you bring the learner in because you engage them as a participant in their treatment specifically, I think it adds the missing component that I've been trying to articulate for myself, because that's more the world I live in, and because it's the world that fascinates me. Because I find it so fascinating.
I would love to learn more about his work, and I would love to get the references.
Oh, sure, I'll send it to you. Absolutely, I will send it to you. That's great. That's man, I lost my train of thought, but that's I have to say, like, what I love about what you just said is that it's not about focusing on just specific overt things that you can see and dictating that stuff. It's about creating this dynamic interaction.
Perspective.
Yeah, it's a contextual, holistic perspective where it's like, it's dynamic. It's focusing on teaching skills that encompass not just a response in the environment, but also the interactive mechanisms that create that as a meaningful thing. I love that. That's great. Danielle, I know you had a couple things about this, if I'm not mistaken.
I think most of them were addressed, but one thing that really caught me in some of the discussions around your books is your talk about nurturing and empathy and compassion. And I was just curious if you had read anything by Tony Biglin.
What's the last name again?
Tony Biglin.
Anthony Biglin, I think, is what he publishes under.
That's more familiar.
The Nurture Effect. He's got a book called The Nurture Effect. I mean, it's just amazing to meet all these great minds who you're all
saying such similar things.
Well, it's like evolutionary. It's like it's like clinical convergence. It's it's an evolutionarily good idea when it's coming out of so many different places.
And each with their own little, I guess, like subtle differences, spins, different like targets, like. They mesh well, and they could build off of each other, in a sense. Yeah.
But that may reflect the direction that things are evolving in. As people say things that are similar, but in somewhat different ways, I think things do start to slowly but surely move. right? And my original writings were not for, I don't write for behavior analysts, right? I write for parents, and I write for educators, and I write for clinicians, right? Most of the writing I've done has not primarily been for behavior analysts. It's something that I would be delighted to explore. It's something, truth is, I keep looking for somebody to co-author this paper with me. It's how do collaborative and proactive solutions and applied behavior analysis converge and diverge. And
Dimitri might be
we might need to talk about that, because I'm starting my dissertation in about 4 months, and I think basically I was trying to figure out kind of what you have going on to do it from a behavior analytic perspective. Because my obsession is signs of damage as a function. I'm a big Gold Diamond fan, and we were talking, but that doesn't. But I find it fascinating where, like, if the reinforcer is seeing the disappointment on the other person's face, whatever that kind of like negative social interaction that you get from the ODD type of characters and the ADHD types, where the words are so heavy rather than just the actual actions. And trying to mitigate, control for that, and then create this kind of sweeping, holistic response. That's why this is a very selfish endeavor. Talking to you is a primer for me, if I'm being totally straight with you.
That being said, there's quite a few nerdy analysts on here that'll definitely be clicking through and checking stuff out, though.
Yeah, we keep it nerdy too.
And actually, just kind of touching on that, is there any resources outside of your books and your documentary that you might direct some behavior analysts to that could help them open up their circle of what they read from other interdisciplinary areas?
Well, the people who influenced me might influence them. I've already mentioned one of them, and that is, if you haven't already, read the vast literature telling us about lagging skills in kids with social, emotional, and behavioral challenges. Read that. Start with Russell Barkley and his articles about Bronowski's theory and how it overlaps with executive skills and what executive skills are. Now, to me, for me, anybody who's working with kids, that should be standard training. Right?
Cool.
But if that's something people missed, that's something you can't miss. The other folks who were very influential on me were a somewhat obscure guy at this point named George Kelly, who had a theory called personal construct theory. He had this book, I think, called A Theory of Personality. In the other room.
I can search for it and try to verify what you described.
I think it's called A Theory of Personality, George Kelly. I hope it's still in print. And what he talked about was how humans are active construers and interpreters of our world. And what we do is we try a certain construct on for size. And if it continues to make sense to us, we stick with it. Not only do we stick with it, we tend to start, and this is other research, discarding information that comes into us that contradicts our existing schemas, right? But he likes, so we have schemas, right? And, collaborative and proactive solutions is a schema. It brings with it certain lenses and a certain language. I hope that people who practice the model are still open to other ideas. I don't want it to be rigid and dogmatic. The people who you all have the most disagreements with are the people who are taking applied behavior analysis and being rigid and dogmatic about it.
Yeah, that is against my religion, so that's against my dogma, ironically.
There you go. But that doesn't mean that they aren't coming from a valid place. It just means that there may be resources that might have opened their minds up to other schemas. So George that they haven't accessed yet. But probably the biggest is goodness of fit theory and transactional models of development. Goodness of fit started as a statistical theory, but then in the 50s, by very brilliant people whose last name should be familiar to anybody working with kids: Thomas, Chess, Birch, Bell. They came up with this very fascinating, simple theory that a person's outcome, and it, by the way, it's just as true now as it was then. A person's outcome basically occurs as a function of the degree of fit or match between their characteristics and characteristics of the environment. When there's a good fit, they mesh. Yeah. When there's a good fit or a good match, we have what's known as compatibility. When there's a poor fit between those characteristics, we have what's known as incompatibility. I talked about this in Raising Human Beings a little bit. Incompatibility between expectations and the skills a kid has to deliver the goods on those expectations produces challenging behavior. So I'm drawing very heavily, without getting too deep into without getting bogged down in theory. Those are theories that are still very relevant. But perhaps the most important thing I learned in grad school was everything's 100% nature and 100% nurture. Transactional models of development. There's the dynamic interplay between nature and nurture, between environment and person, never ending. If all we're focused on is environment, if we have such great faith that modifying environmental contingencies can get it all done, we are going to miss the boat on an awful lot of kids and an awful lot of problems. So the question from Danielle was, what steered me in a different direction? Those are the theories that steered me in a different direction. But those theories should be part of anybody's training if they're going to be working with kids.
I'm going to look it up.
It does appear that George Kelly's book is still in print, so folks can snag that.
An amazing book. Boy, does it explain.
We'll put it in the show notes. We'll put it in the show notes for sure. We'll put it in the show notes.
And it's interesting that you say that anybody that's working with kids should read these things, because we get into this conversation all the time that our program and our training for behavior analysis tries to be so broad, but it's also so narrow in scope at the same time.
Conceptually.
Yep.
And so, we funnel a lot of practitioners into the autism or developmental disabilities world working with children. But I know for me, the doctorate program was a way of looking to expand beyond just those areas. But it's just interesting, like none of my grad programs, none of my master's classes touched on any of that stuff. Our first child development class, for me anyways, was in the doctorate program.
I had to learn that completely on the side. I was lucky to have a pharmacology class and other things like that, but again, it was just touching the tip of the iceberg on those topics.
Yeah, that's really good.
I give a lot of credit to the graduate program in clinical psych that I went to. I went to Virginia Tech. I am still remarkably indebted to the people who taught me there. If the clinical psychology program at Virginia Tech hadn't made it so that you had to take classes in developmental psychology, I might never have been exposed to transactional models of development. I might never have been exposed to goodness of fit theory. That might not have been part of my education, and those things really radically transformed my thinking. So I give a lot of credit to where I went and the breadth of the training that I received, because it wasn't just clinical psych classes it wasn't the clinical psych classes that necessarily transformed my thinking. It was the classes that I also had to take in addition to those that transformed my thinking.
Man, I just had this realization as you were saying that, in terms of, I think, a significant missing component, and this is because we're big on philosophy. At least I'm real big on the philosophy stuff. Like that's my favorite part of doing this, and I've seen more and more this running theme of an absence of narrative, and which I think what conventional psychology or what psychology proper does better, and like I think you just demonstrated that, is that it's a lot better at giving cohesive theory that brings things into an interpretive framework that makes sense. And I think we're really bad at that. I think we have good models. I mean, the three-term contingency is a good model for that particular thing. Whatever. Pick the model, and it's good. But these meta narratives that tie it all together, that lets you take all the information, use the model to get some type of variable that matters, but then actually effectively interpret it in terms of analysis. That is a that is actually what's missing, I think, more than anything. That just came to me as you were talking. That's fantastic. That's a good takeaway. I mean, don't just read your philosophy. Actually, read some additional theory and some models so you can get some perspective. That's great. Mm-hmm. Yeah, I love that.
What I've done with CPS is I've incorporated, and this is goodness of fit theory if it ever existed, but I've simplified it, right? Clearly, there's more about the kid than skills. Clearly, there's more about the environment than expectations. But if I have to distill it down for people in terms of the basic elements that you need to look at when it comes to kids who have challenging behaviors, I'm actually content with lagging skills as the kid characteristic. There's much more to kids than that, but lagging skills and unmet expectations, unsolved problems as what the environment is bringing into the mix. So number one, I'm bringing in both. That's crucial. It's not just one or the other, it's both. But the collaborative piece is, how do you, if it's both, in a model of intervention, how do you reconcile that? Because if it's only environment, then adults are arranging environmental contingencies, or the adults are the ones who are figuring it all out. And therefore, adults are depriving themselves of access to this kid's experience, to this kid's interpretation of this kid's experience, to what the kid has to say about what's hard about meeting that expectation. And we are also depriving ourselves of the kid participating in solving the problems that affect the kid's life. Why would we want to do that? We wouldn't. So it's interesting. Those theories are what contributed to the model. The model is an oversimplified, practical, here's how you can bring those theories to life in the real world application.
In working out CPS in working out your running theory and your analytic framework, what was the hardest nut to crack? Like where was it just challenging to work out all the pieces to get them to mesh and make sense and fit it together into this digestible kind of distillation that you're talking about?
Well, now I'm going back to what it looked like in the beginning. What it looked like in the beginning was simply a means to help adults prioritize. Very, very, very early on, Plan A, Plan B, and Plan C were helping people decide what's really, really important, what's kind of important, and what's not important at all at this point, right? Because initially, it was a response to helping parents who had so many expectations that their kids were having difficulty meeting. And eventually came the phrase, if all of your expectations are equally important, then none of your expectations are important, right?
If we're all special, nobody is.
Exactly, right?
Great.
But then very rapidly, it turned to, okay, now that we've prioritized, what are we doing with them, right? And this is part of the evolution of the model, because in the beginning, Plan A was for issues involving safety. Now, I'm recommending that people almost never use Plan A, right? I'm recommending, I don't see the point in being unilateral almost ever anymore, right? Plan B doesn't really matter whether the kid's behavior, so this is how it has evolved, right? Eventually, it turned into, wait a minute, why are we so focused on behavior here? Behavior's late, right? The fact that he's hitting doesn't tell me why he's hitting, doesn't tell me what happened before he hit. What happened before he hit? And then very rapidly, it started moving in that direction. How are we going to solve that, right? Not what are we going to do about the behavior, which is what everybody was asking, and what a lot of people still ask, right? So that
did you get a lot of heartache doing that? Well, like, did you get a lot of heartache working that out? Were people resistant when you were talking about that, or?
Well, the good news is that because I'm behaviorally trained, and because I like stuff that I put forth to be as bulletproof as possible, there was a fair amount of field testing before I put anything out, right? Then I said, I got to put this out. This is different enough that somebody's got to know about it, right? It was never my goal to. I never envisioned writing books. Yeah. I never envisioned doing a documentary. These are things that sort of have evolved over time. But the biggest hurdle for me was probably moving away from behavior and toward the problems that are causing those behaviors. But because I was behaviorally trained, I knew what people were going to say about that, and so I was ready. So I would not say that it caused a lot of heartache, because I was able to. Truth is, when I was writing, part of it was I was writing for people who were trained like I was. How did I make the transition? When did I start making the move from behavior to the problems that are causing that behavior? So to tell you the truth, it's been a blast. I wouldn't say that much about it has caused me great heartache. I will say that I was petrified, right? Mm-hmm. I was, well, you know, I was worried about how people who were trained the way I was would respond to what I was saying if I didn't explain it as well as I could have, right? And so, truth is, I just put a lot of energy into explaining it as well as I could have. And I still got some pushback from people who, you know, we're using different terminology. What's interesting is more of the pushback that I'm aware of. You know, you're not always aware of pushback, but the pushback that I was aware of came from terminology, which is where I also learned, hey man, I think we're saying the same thing, except that you're speaking one language and I'm speaking another. But I can't say that there's been a lot of heartache in developing or disseminating this model, mostly because it's built on a solid foundation of research. And the truth is, I've got social learning theory to fall back on. That's one of the places where this model originates, right? So if social learning theory, brilliant people, Walter Mischel, Albert Bandura, you name it, Michael Rudder, developmental psychopathology, right? I'm on solid ground here. I just need to make sure that people are aware of how what I'm saying connects to the solid ground.
The connections.
Yeah, I mean, I could probably keep you on here for like 3 hours, but I'm not going to do that. So I really want to just have a couple more. So why don't we talk about the Kids We Lose real quick a little bit, if you don't mind, because I'd like to ask some questions about that.
And the nonprofit organization, because I think where that stems from is great.
Let's talk about both of those things. So let's talk about the documentary, and maybe we'll close with your organization. But where do I even start? That the young man in prison being interviewed, that was super powerful. So are those folks that you've worked with, or are they folks that you've just known that you recruited through the years that fit what you were looking to do and that kind of thing? Like, are you familiar with their cases and you've been involved?
Well, the gentleman who's in prison and is no longer in prison. Because of my connections in the corrections system in Maine, we were able to access incarcerated adults, and his story really resonated with us.
Yeah. I mean, that school to prison pipeline point that you made, I think, is so poignant, and I think that it will. I mean, yeah, it was powerful and poignant. I definitely. it's a reality that we need to face because so many people are impacted by it, and it's a bane in our society. I mean, it is a stain on our society. So I think you really highlight that in a way that's just really awesome. One thing that I was a little was it just a point to talk about the education system in general? Is that your primary critique, or was it just in generally to highlight the reality that this population faces? Because I feel like there were so many lessons that you could take away from it. I'm just curious from your point of view, what was your main priority?
Take them all.
Whatever your interpretation is, Dimitri, I don't care.
That's a good movie. Another facet of the film, I hope, is that being disadvantaged in this country puts you behind the 8 ball. So there is it is not inconsequential that the kid in Mississippi who did an armed robbery got 30 years, and that the guy in Maine whose wife is dead at his hand got 6 years. People want to take that from the film. I'm perfectly okay with that. The goal was it was intended as an expose.
Mm-hmm.
So in its most basic form, it was intended to say, look at what we're still doing to kids here in the year 2020.
Mm-hmm.
And look at how it contributes to their outcome. You know, what I say to people, anybody who feels, there are a smattering of educators who have had a less encouraging reaction to the film because they felt blamed.
Yeah, I can see that.
We bent over backwards in the film to talk about how hard it is to be an educator these days, right? What's walking in the door, the pressures they're under, how they give their heart and soul to their profession. So it was our goal for educators not to feel blamed. Educators are stuck with the discipline systems that they inherited. That's not their fault. That's not their doing. Educators are stuck with overcrowded classrooms. Educators are stuck with the systems that are in place, that most of which are obsolete, and most of them which they would acknowledge don't work, right?
Designed for an agrarian age.
We're stuck, yeah. Right? And so I hoped that educators would feel, this might have been a bit of a reach, empathized with, but there's certainly content in the film that is very empathic toward educators and what they're facing, right? Yes, the kid is coming in with characteristics that make that kid difficult to manage in the general ed classroom as it presently exists. But the other big piece of it is what we do to them and how we understand them and handle them, right? So that's what the film was attempting to bring together. Yeah, this is definitely a tough kid, no question about it. Now, how are we doing? Are we helping this kid? Are we doing more harm than good? Are we violating the Hippocratic Oath? So the fact that it also cements home the points about the school to prison pipeline, outstanding. But what it's mostly saying is, what we are still doing in way too many places to these kids is extremely counterproductive, not helpful, and that's the recipe for losing a kid. That's, in a nutshell, what we attempted to do with the film.
So here's where I have to say, even I had a little bit of like I don't know about that. So I'm just going to ask you about it up front, because I think we're in a safe place here. I hope that we're no, we are. I promise. But I mean, my thing is more like, so I absolutely agree with the notion of like suspension, expulsion, completely ridiculous. I think that the fact that that's even part of the disciplinary process, quote unquote, is absurd. Seclusion and timeout, I struggled a little bit with that in its entirety, because I agree there's a lot of frivolous usage of it. I think especially when it comes to having police officers in the school and using them almost as the security force for managing behavior, which is, again, unethical is not the right word in my opinion. Inhumane is more accurate, because it criminalizes childhood.
That's right.
Yeah, it criminalizes being a child, basically. It's disgusting. On the other hand, I think that especially if you're working with high intensity behavior, you have to talk about health and safety a little bit at some point, because there are situations where, I mean, I've almost been stabbed by someone multiple times. I can't tell you how many. I mean, I literally broke my neck doing this work. I ruptured multiple discs. I've had to have spinal reconstruction. I've done some heavy duty lifting and doing this work physically. So I can say that, you know, from the high intensity impact that you get, I mean, there are times where you just have to protect yourself too. So thinking of the need to intervene, while not frivolously, there are emergency circumstances that may require it. And I got a little bit of a takeaway from the film where it was like totally unacceptable and always immoral and unethical. And I think I understood your audience, which is why I was like, I understand with the audience here. So I think in a reasoned conversation it might be different or whatever. But when you hear me say that, are you saying, I've almost got you, but you're still resistant, Dimitri? Like, and I'm going to change your mind right now. Like, what do you think?
More the latter.
Okay, hit me with it. Tell me then.
Well, if we teach people who are working with those kids so-called crisis prevention strategies, basically consist of de-escalation, restraint, and seclusion, then they are going to be primarily de-escalating and restraining and secluding. And they're going to be doing that in the name of crisis prevention.
Yeah.
That is not crisis prevention. That is crisis management.
Yes.
By the time the kid is becoming escalated, you're late. By the time you are using de-escalation strategies, you're late. When your de-escalation strategies don't work because you were late, and you're restraining and secluding, you're very, very late. But that's how we're training people. We are also, in most special ed classrooms, primarily often working on behavior modification programs, which are also primarily focused on what's late behavior. So now, what would the world of restraint and seclusion, first of all, there are many, 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 many classrooms in which those very same kids are present who are not using restraint and seclusion. So apparently it can be done, right? What are they doing differently? Well, the ones that we work with are no longer focused on behavior, which is late, are paying very close attention to the expectations they are placing on kids. One of my favorite things to say these days is that, you might disagree with this, but we'll see. Most restraints and seclusions are caused by expectations we already know a kid was going to have difficulty meeting. And yet we put the expectation on the kid anyways. So I like talking about expectation management, not behavior management. There are a lot of kids in special ed classrooms, and 75% of restraints and seclusions are used on kids with disabilities. So we're basically talking about special education classrooms here, right? Fueling this is initiatives in education that compel us to get the most out of every kid, because we want to get every kid performing at the optimum level. But we also know that in special ed classrooms, there are kids who are completely unstable on meds, who are not on meds they could be on that would be stabilizing them. There are kids in special ed classrooms who are so unstable, they aren't going to meet any expectations anytime soon. What percentage of restraints and seclusions have I just accounted for? Now, those aren't the frivolous ones, right? There are a lot of frivolous ones too. There are ones that are just, what did you do? And
the med instability in particular is a great. That's really what I'm talking about. Is people that are on that like, they're dancing on a hairpin, and we're talking about a hair trigger reaction, or even the slightest, not inconsistency is not the right word, just like slight, and you go from 0 to 100, and that explosivity is there. You know, that's where I was in my head.
Before the kid goes from 0 to 100, somebody's put an expectation on that kid. Maybe, by the way, not an expectation for completing a math assignment, just the expectation that that kid be able to deal with being in a classroom with the noise and the comments and these close proximity, right? So I'm always asking, if we debrief the vast majority of restraints and seclusions, we will find that we were putting an expectation on the kid that we already knew the kid couldn't meet. Why are we doing that? Because often we want to get the best performance out of a kid. We want maximum performance, but also because of how we've set up these classrooms and the options that are available to us, right? So I'm all about expanding options. I've helped lots of school systems create a stability program, right? For kids who are simply, I'm not talking special ed classroom here. I'm talking about a kid who is unstable on meds and unable to meet almost any expectations. What is that kid doing in that classroom right now and getting restrained and secluded a lot, right? So do I think, because I know that it's done, we can get to zero restraints and seclusions? I think that's where we want to set the bar.
Yeah, I'm with you on that.
I think that every once in a blue moon, something's going to get past us and we may have to do that. Yes. What should that look like? Well, now I'd rather use pads and buffers instead of laying Mm-hmm. on a kid, as the Ikuro people would have us do, right, out of Grafton. Mm-hmm. So do I think that laying hands on kids is now becoming an increasingly obsolete practice? Yes. Should you need it, you should be trained in a different strategy besides laying hands on kids. But even that's crisis management. What I say to the educators I work with all the time is, I am going to get you out of the heat of the moment. Heat of the moment, you don't want to be there, kid doesn't want to be there, but I think heat of the moment is 99.9% predictable if we know what the kid's lagging skills and unsolved problems are.
That distinction is, I think crisis prevention and crisis prevention as a term has been hijacked to better market crisis management.
Yeah.
No, for real. No, that's, and I agree. And that's the reality of it. That's the reality of it. The reality of it is that it's just, it's intentional misapplication of terms that creates it almost an impossible way for us to communicate with people to make these distinctions that matter. Because, I mean, you should always be engaging in the highest level of crisis management, and a good behavior modification program, quote unquote, at least from my perspective, should be that. That is a good behavior, because it's that totality that you're talking about in terms of CPS. So I actually don't disagree with what you just said. I'm with you all the way on that. I think that I think the blame game gets hard, and I do think that in considering practitioners and their reality matters, and I think that people get defensive when they feel like that's what's happening. And
totally understandable.
But I think your point is poignant, well taken. I think what you're saying is absolutely the direction we should be heading, and we should be designing our education system towards.
I got defensive the first time somebody questioned my behavioral training.
Yeah.
Then I thought about it.
Yeah, exactly. Yeah, I'm with you on that. No, I think that's fair. I think that's totally fair.
And this is like a big piece of the nonprofit organization too, is
nonprofit disseminates the model, and we've got a new website, truecrisisprevention.org, that has a very important graphic on it that shows the sequence of restraint and seclusion that is very, very helpful in helping people come to recognize what's early and what's late. If it's late, it's crisis management. If it's early, it's crisis prevention. And it makes it crystal clear to people that what a lot of folks were trained in under the guise of crisis prevention was really crisis management. I think of collaborative and proactive solutions as completely oriented toward crisis prevention. I don't know that many other models that are oriented toward crisis prevention, but I think that is the direction we need to be really thinking about. How are we going to get people out of the heat of the moment? And are these strategies that we are prescribing for them keeping them out of the heat of the moment, or more often putting them into the heat of the moment?
Oh man, modifying expectations versus following through with contingencies. It's that's spot on. I mean,
it's marvelous.
It's marvelous. I don't know how anyone who would
marvelous,
marvelous, yeah, for sure. I guess one last question for you, because I know we've had you for a while now. What would be the one piece of advice you would give to up and comers who want to expand their careers or their mindset, their just like the way that they approach these problems, and what do you think they should do or think about while they're doing that?
Look beyond your training.
Fantastic.
It's beautiful, yeah.
Marvelous, man. Thank you so much, Dr. Greene. Ross, you're the best.
This is the most fun 90-minute thing I've done. Most of them are sort of pretty straightforward Q&A. I don't often get to bounce ideas around with people like this. This has been a blast.
Awesome.
Send me your master's thesis, please. I want those references because I'm always eager to learn from people who I have not dived into their work. Yeah. So thank you for inviting me to do this. It's been a real pleasure.
Oh, it was a fantastic getting to meet you, and I hope that we get to do it again one day.
I have one other off-air question real quick, so I'm going to pause.
Sure, off-air question.